Hi, and welcome to Veritalks, Emerging Trends. Today we'll be discussing the new anesthetic agent, Alfaxalone. In this short episode, we'll cover what Alfaxalone is, when it should be used, and how you can use it. Alfaxalone is an induction agent, similar to propofol, with a rapid onset and a clear recovery. However, it has fewer cardiorespiratory effects than thiopental, ketamine, and propofol, and a larger margin of safety. Alfaxalone was released in Australia and New Zealand in 2002, South Africa in 2006, the United Kingdom in 2007, Continental Europe 2008, Canada 2011, South Korea, Taiwan, and Japan in 2013, and most recently the United States in 2014. Alfaxalone works by activating GABA inhibitory neurotransmitters, which are the same neurotransmitters that are affected by propofol and benzodiazepines. It is metabolized by the liver and eliminated unchanged via the kidneys. Alfaxalone is a Class 4 controlled drug. Studies have shown Alfaxalone to be an acceptable induction agent in high-risk patients, C-section patients, and juveniles less than 12 weeks old. It is safe to use in sighthounds, though drug clearance has been shown to be 5 times longer when the patient has been pre-medicated. Alfaxalone can also be used for total intravenous anesthesia. It is used in a CRI in the same way you would use propofol, which is an attractive alternative for cats that need to be anesthetized multiple times over a period of days. Alfaxalone has also been used in rabbits, snakes, ferrets, rats, and many other exotic species, although it has not been shown to be quite as successful in birds. The labeled dose is 2 to 3 milligrams per kilogram IV in dogs and 2 to 5 milligrams per kilogram IV in cats. You can potentially use a smaller dose depending on the pre-medication regimen that you use. Pre-medication of the patient should proceed as normal with whatever is appropriate for the status of the patient and the procedure. Give Alfaxalone slowly, to effect, over about 60 seconds until intubation is possible. You can use co-induction agents such as midazolam or ketamine with Alfaxalone, but should not mix them in the same syringe according to the label. One of the primary advantages of Alfaxalone is that it is suitable as an intramuscular sedative for fractious cats off-label, even following unsuccessful sedation with other drug regimens. Importantly, it does not cause pain upon injection. Now let's hear from Dr. Elizabeth Martinez at the Texas A&M Veterinary Medical Teaching Hospital.
I mainly use it to immobilize the cat for IV catheterization, to then be followed by IV induction and intubation. However, it can also be used for procedural sedation, such as blood collection and urethral obstruction. The onset is about 2 to 6 minutes, and the duration is about 20 minutes. Alfaxalone can be administered IM at a dose of 2 milligrams per kilogram and can be given in combination with midazolam at 0.2 milligrams per kilogram and/or butorphanol at 0.2 milligrams per kilogram for additional analgesia and muscle relaxation. Alfaxalone does not provide adequate somatic or visceral analgesia to be used as the sole anesthetic agent for surgical patients, including castration in cats.
Alfaxalone can be given IM in very small dogs at the same dose as cats, but volume poses a challenge in larger canine patients. Additionally, since the clearance rate in dogs is faster than cats, it should only be used to provide you with time to place a catheter before using other anesthetic agents for the duration of your procedure. It is important to note that because Alfaxalone does not contain a preservative, the label states that open product should be discarded within 6 hours. That's all for today's emerging trend, Alfaxalone. Thanks for joining us. As always, you can visit Veritasdvm.com for more veterinary resources.